Have you ever wondered why some Australian Shepherds are suddenly getting very sick after taking normal flea and tick medications? Hi, welcome back to Paw and Order. My name is Carl, and today we are going to talk about a very important topic for all Aussie lovers out there. These dogs are beautiful and smart, but they can suffer from some serious genetic problems that every owner must know about. The first major issue we need to look closely at is called the MDR1 gene mutation. This is a special genetic change that makes your dog super sensitive to common medications that are perfectly safe for other breeds. When an Aussie has this mutation, their brain cannot pump out dangerous chemicals correctly. This means a simple worming tablet or a flea treatment can actually act like a strong poison inside their body. It can cause major brain issues and even lead to death if you do not catch it quickly. You must get a simple cheek swab DNA test from your vet to check if your dog has this bad gene mutation before giving them any new strong medications. The second massive health concern we need to watch for in this breed involves their gorgeous eyes. Australian Shepherds are uniquely prone to an inherited condition known as hereditary cataracts, which causes the clear lens inside their eye to become very cloudy. This cloudiness stops the light from entering the eye properly, and it slowly makes their vision blurry over time. Most of the time this specific problem starts showing up when the dog is between 2 and 7 years of age. If it is left completely untreated, it can cause total blindness, or even lead to an incredibly painful condition called glaucoma. The best way to protect your dog is to ask your breeder for clear eye certificates from the parents before you buy a puppy. You should also take your adult Aussie to a special dog eye doctor once every single year for a professional checkup. Catching it early means you can look into surgical options to fix their sight completely. Moving forward into our third topic, we must discuss another common eye issue called collie eye anomaly. This is a very specific genetic problem, where the back layer of the eye does not grow the right way, while the puppy is still developing. This specific layer is supposed to bring vital blood and healthy nutrients to the retina, which helps your dog see the world clearly. When it is too thin or poorly formed, the dog can suffer from mild vision loss, or even a completely detached retina. This issue is present from birth and it does not actually get worse as they get older, but it can still limit their lifestyle significantly. Professional breeders can do a genetic test to make sure they are not passing this condition down to new litters of puppies. As an owner, you can help a visually impaired Aussie by keeping your home furniture in the exact same place so they do not bump into things. Our fourth major concern brings us to the structural health of your dog, specifically looking at hip dysplasia. This is an inherited bone condition, where the ball and socket joint in the hip does not fit together snugly, or grow smoothly. Instead of gliding nicely, the bones constantly rub and grind against each other every time your dog runs or walks around. This continuous grinding causes painful swelling and slowly destroys the smooth protective cartilage over time, leading to early arthritis. You might notice your active dog starting to limp or showing a strange bunny hopping walk when they try to run fast. To manage this issue properly, you need to keep your Aussie at a very lean and healthy weight to reduce pressure on the joints. You can also talk to your vet about starting high-quality joint supplements like glucosamine early in life to protect their movement. The fifth critical health issue that everyday owners face with Australian Shepherds is a scary brain disorder known as epilepsy. This condition causes the dog to experience sudden and recurring seizures because of abnormal electrical activity happening inside their brain. For most Aussies who inherit this specific condition, the very first seizure will usually happen before they reach 3 years of age. During a seizure, a dog might lose its balance completely, fall over on its side, and start twitching its legs wildly while foaming at the mouth. It is an incredibly terrifying thing to watch as an owner, but you must try to stay calm and keep them safe from sharp objects. Your veterinarian can prescribe special daily medications that help control these brain misfires and let your dog live a normal life. It is very helpful to record a video of the episode to show your vet for an accurate diagnosis. For our sixth section we need to look at another serious joint issue, which is elbow dysplasia. Similar to the hip problem, this happens when the three individual bones that make up the dog's elbow do not grow at the exact same speed. This uneven growth creates a bad alignment inside the joint, which causes tiny pieces of bone to break off, or wear down rapidly. It causes significant pain in their front legs, and you might see your dog resisting going for their favorite walks, or struggling to stand up after resting. A vet will need to take detailed X-rays to see exactly what is happening inside the elbow joint. Treatment often involves careful weight management, special physical therapy, or even advanced surgery to remove loose bone fragments. Keeping your puppy from jumping off high surfaces while their bones are growing can help prevent making this condition worse. The seventh health topic we must dive into is the danger surrounding double merle breeding practices. When two beautiful merle-colored Australian Shepherds are bred together, their puppies have a high chance of inheriting two copies of the dominant merle gene. These specific puppies are often born almost completely white, and they face a massive risk of severe developmental problems. Many double merle dogs are born completely deaf in one or both ears, and they often have malformed eyes that cause total blindness. This is an entirely preventable issue that only happens because of uneducated or careless breeding choices in the dog world. If you choose to adopt a double merle dog, you will need to learn special hand signals or use vibration collars to communicate with them safely. They require an extra level of care and dedication, but they can still make wonderful loving family companions. Coming to our eighth crucial point, we have to address a hidden danger known as autoimmune thyroiditis. This is a chronic condition where the dog's own immune system gets confused and starts attacking the healthy tissue of the thyroid gland. The thyroid is responsible for producing important hormones that control your dog's daily energy levels and metabolism. When it is damaged, it cannot produce enough hormones, which leads to a condition called hypothyroidism. You will notice your once energetic herding dog becoming very lazy, gaining weight without eating more food, and losing patches of their beautiful fur. Their skin might also become very dry, thick, and dark in color. Luckily, this problem can be found with a simple blood test at the clinic. It is easily treated with a cheap daily hormone replacement pill that brings their energy right back to normal. Our ninth topic focuses on a very dangerous and hidden health threat called hemangiosarcoma. This is a highly aggressive type of cancer that specifically attacks the cells that line the blood vessels of the dog. It most commonly develops inside major internal organs like the spleen or the heart, where it forms silent tumors. The terrifying part of this disease is that owners usually do not see any signs of sickness until a tumor suddenly ruptures internally. When this happens, it causes rapid internal bleeding, which makes the dog suddenly collapse, become very weak, and show very pale gums. This is a major medical emergency that requires immediate veterinary care to save the dog's life. While it is a genetic disease, keeping up with regular vet exams and getting abdominal ultrasounds for older dogs can help detect changes early. For the 10th topic, we need to discuss a second common type of cancer in the breed, called lymphoma. This cancer targets the lymph nodes and the entire immune system of your Australian Shepherd, making it hard for them to fight off basic illnesses. The most obvious sign of this disease is the sudden swelling of the lymph nodes, which feel like hard marbles under their jaw, behind their knees, or in their armpits. Unlike other infections, these swollen lumps are usually not painful to the touch at all. Your dog might also experience a loss of appetite, weight loss, and a general lack of energy. If your vet diagnoses lymphoma, they will usually recommend chemotherapy treatments. Dogs actually handle chemotherapy much better than humans do, and it can successfully put the cancer into remission, giving you more precious time together. The 11th health issue on our list is a distressing behavioral and physical problem known as severe anxiety. Australian Shepherds are incredibly intelligent working dogs that were bred to herd livestock all day long in large open spaces. When they are kept inside a house, without enough mental stimulation or physical exercise, they can develop deep emotional stress. This anxiety often shows up as destructive chewing, escaping from the yard, barking constantly, or compulsively licking their own paws. This constant licking can create painful open sores on their skin, called hot spots, which easily get infected. To fix this, you must give your Aussie at least 2 hours of active exercise every day, and use puzzle toys to challenge their smart brains. Working with a professional dog behavior trainer can also help calm their anxious minds. Our 12th important point covers common skin allergies and irritating infections that plague this thick-coated breed. Because Aussies have a dense double coat of fur, it is very easy for moisture, dirt and bugs to get trapped close to their skin without you noticing. They can develop strong allergic reactions to things in their environment, like pollen or certain proteins in their daily dog food. This makes them scratch their ears, bite their paws, and rub their face against the carpet, until their skin becomes bright red and raw. If bacteria or yeast get into these scratched areas, it creates a smelly and painful skin infection. You can prevent this by brushing their coat thoroughly every week, to remove dead hair and keep the skin dry. Your vet can also help find the right limited ingredient diet, if food is the main issue. The 13th health issue we need to highlight is a painful condition present at birth, called an umbilical hernia. This happens when the small opening in the abdominal wall, where the umbilical cord was attached, does not close up completely after birth. This leftover hole allows a bit of belly fat, or even a piece of the intestine, to push through, creating a soft bulge on their stomach. If the hole is very small, it might close up on its own as the puppy grows, or it can simply be fixed during their routine spay or neuter surgery. However, if the opening is large, a loop of the intestine can get trapped and lose its blood supply, which is a deadly emergency. You should check your puppy's belly regularly and have your vet evaluate any strange lumps. For our 14th topic, we must look at a painful condition called nasal solar dermatitis, which is also known as collie nose. This issue specifically affects Australian Shepherds that have very light pink skin, or a lack of dark pigment on their nose area. When these dogs spend a lot of time outside under the bright sun, the sensitive skin on their nose gets severely sunburned. Over time, this constant sun damage causes the skin to crack, ooze, lose its hair, and form painful crusty scabs. It can look very similar to dangerous autoimmune diseases, so it always needs a proper veterinary exam to be sure. You can easily protect your pink-nosed Aussie by applying safe dog-friendly sunblock before they go outside and limiting their playtime during the hottest hours of the day. The 15th and final health issue we need to talk about is a urinary tract condition called hyperuricosuria. This is an inherited genetic defect that changes how your dog's kidneys process uric acid from their daily food. Instead of dissolving safely, the uric acid builds up in high amounts inside their urine and forms sharp crystals or hard stones. These stones can scratch the inside of the bladder, or completely block the flow of urine, which is incredibly painful and dangerous. You might notice your dog straining to pee, crying out in pain, or having blood in their urine inside the house. A DNA test can tell you if your dog carries this specific gene mutation. If they have it, you can easily prevent stone formation by feeding them a special low purine diet, and always providing fresh water. Thank you so much for spending your valuable time hanging out with me today here at Paw and Order. I am Carl, and I truly hope this unique guide brings you beautiful life with your furry companion.